think I wanted to become a doctor because it seemed like something that would be intellectually stimulating and personally and professionally gratifying while providing the opportunity to help people. I'm Dr. Benjamin Kyle Potter, an orthopedic surgeon and the chair of the Department of Orthopaedic Surgery here at Penn Medicine. So I have two main clinical interests. One is in the care of complex sarcoma and cancer patients, trying to ideally render them disease-free or at least achieve local disease control, and then engaging in complex limb or pelvic reconstructions to not just hopefully cure the patients of cancer, but provide them with the best possible functional outcome and quality of life. My other interest is in advanced care of patients with limb loss, and that's something I was inspired to during my time as a military surgeon. I was inspired to sort of pursue the best practices with regard to amputation and amputation revision surgery, up to and including limb bionics and advanced technologies that can really kind of merge man and machine to improve functional outcomes. If we're able to save your limb, and that's commonly referred to as limb salvage, and limb optimization really focuses on going the extra mile after limb salvage has been successful or amputation is required. Limb optimization is really the principle of, okay, your fracture's healed, but you're still having pain, or you've lost a critical muscle group, or you don't have sensation in your limb, or you've had an amputation, you have poor soft tissue coverage. So what can we do, whether it's through bracing or a new prosthesis, more rehabilitation, or a surgical procedure to truly optimize your limb and maximize your functional potential? Osseointegration and limb optimization are two different but related concepts. Osseointegration, in an orthopedic sense, refers to the direct skeletal attachment of an implant to bone. And with regard to patients with limb loss, it also involves the transcutaneous attachment of a prosthesis. So it's a bone-anchored prosthetic limb. We can place an implant or fixture inside the bone, exteriorize a portion of the implant so that they're able to, for lack of a better term, clip and go into their terminal device. But the real benefits are more in terms of function, in terms of the responsiveness of their terminal device, patient ownership and embodiment, feeling like the prosthesis is a part of them rather than a brace or a tool they use to do things, and better functional potential and quality of life following limb loss. The Department of Orthopaedic Surgery is trying to grow clinically and expand our depth in specialties that we already have world and nationally known experts in. We're trying to substantially increase our clinical research in terms of funded trials for new devices or new interventions to help improve patient outcomes. And we're trying to revamp and reinvigorate our undergraduate and graduate medical education programs so that we can not just rest on our laurels, but really try to innovate and be the best in the world at what we do. The best part of my job is getting to take care of patients in a world-renowned academic health system that actually cares not just about the patients, but also about our research and education missions, and then the people I get to come to work with every day.